Hey guys, this is FixerMed. Welcome back to my ECG Skills Builder Workshop, where I will be covering all of the fundamental knowledge and skills you will need to read and interpret an ECG in a quick and effective manner. This will be part 10 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. So today I'll be mainly focusing on the QT interval of the ECG. The QT interval represents the duration of the ventricular depolarization-repolarization cycle. Abnormal duration of the QT interval could suggest myocardial irregularity. Duration of the QT interval shouldn't exceed half the distance between consecutive R waves, RR interval, when the rhythm is regular. Moving on to the next slide. Next, let's look at some characteristics of the QT interval of the ECG. Location of the QT interval extends from the onset of the QRS complex to the completion of the T wave. Amplitude of the QT interval varies with the individual's physiology and cardiac condition. Duration of the QT interval varies with age and heart rate, typically between 0.36 to 0.44 seconds. Moving on to the next slide. Next, let's look at some variations of the QT interval on an ECG. Prolonged QT interval is associated with the use of antiarrhythmics, myocardial ischemia, myocardial infarction, MI, and potentially life-threatening ventricular arrhythmias. Shortened QT interval is linked to hypercalcemia and digoxin toxicity. All right, now that we have covered all of the basic content, let's look at some recall-based questions to make sure you guys have retained all of the information during the presentation. What implications arise from an abnormal duration of the ventricular depolarization-repolarization cycle, and what recommendation is given concerning its relation to the RR interval in a regular rhythm? A. Indicates a risk of atrial fibrillation, and it should be shorter than the RR interval. B. Suggests potential myocardial irregularity, and it should be longer than the RR interval. C. Indicates a risk of ventricular tachycardia, and it should be equal to the RR interval. D. Suggests potential myocardial irregularity, and it should not exceed half the RR interval. E. Indicates a risk of heart block, and it should be twice the RR interval. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is option D. Suggests potential myocardial irregularity, and it should not exceed half the RR interval. This option accurately reflects the implications of an abnormal ventricular depolarization-repolarization cycle duration, indicating potential myocardial irregularities. Furthermore, it aligns with the recommended guideline that this duration should not surpass half the RR interval in a regular rhythm, highlighting its significance in clinical assessments. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, incorrect because atrial fibrillation primarily affects atrial depolarization, not the ventricular depolarization-repolarization cycle, and it doesn't relate to the RR interval. B, incorrect as it mistakenly implies that the duration should be longer than the RR interval, which contradicts the guideline. C, incorrect because ventricular tachycardia refers to a rapid abnormal heart rhythm originating in the ventricles, and its relation to the RR interval varies, but it doesn't directly correlate with the duration of the ventricular depolarization-repolarization cycle. E, incorrect because heart block refers to a disruption in the electrical signals between the atria and ventricles, which doesn't directly correlate with the duration of the ventricular depolarization-repolarization cycle. Additionally, doubling the RR interval is not a standard guideline for this duration. Moving on. What defines the QT interval on an electrocardiogram, ECG, and how does its duration relate to clinical interpretation? A. The QT interval represents the duration from the onset of the QRS complex to the completion of the T wave, reflecting ventricular repolarization with a fixed duration across different individuals. B. QT interval duration remains constant regardless of age, heart rate, or cardiac condition. typically ranging from 0.36 to 0.44 seconds. C. The QT interval configuration primarily depends on the shape and morphology of the T wave, indicating the state of ventricular depolarization. D. The QT interval's deflection signifies its alignment with the baseline and varies in direction and magnitude based on cardiac physiology. E. The QT interval encompasses the duration from the beginning of the QRS complex to the end of the T wave, reflecting ventricular repolarization, with variations according to age, heart rate, and cardiac conditions. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is A. The QT interval represents the duration from the onset of the QRS complex to the completion of the T wave, reflecting ventricular repolarization with a variable duration across individuals. This option accurately defines the QT interval, emphasizing its relationship to ventricular repolarization and its variability based on physiological and cardiac factors, which is crucial for clinical interpretation. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. B. Incorrect because the QT interval duration varies with age, heart rate, and cardiac conditions, rather than remaining constant. C. Incorrect as the configuration of the QT interval is not solely dependent on the shape and morphology of the T wave, but encompasses the entire ventricular repolarization phase. D. Incorrect because the deflection of the QT interval is not typically assessed. Instead, its duration and morphology are more relevant for clinical interpretation. E. Incorrect because the QT interval typically starts at the onset of the QRS complex, not at its beginning, and extends beyond the end of the T wave, covering the entire ventricular repolarization phase. Moving on. What clinical conditions are associated with a prolonged and shortened QT interval on an electrocardiogram, ECG, respectively, and how do these associations inform clinical management? A. A prolonged QT interval is primarily linked to hypercalcemia and digoxin toxicity, necessitating prompt correction of electrolyte imbalances. B. A shortened QT interval is associated with the use of antiarrhythmics, myocardial ischemia, myocardial infarction, MI, and potentially life-threatening ventricular arrhythmias, requiring careful monitoring and potential adjustment of medication regimens. C. A prolonged QT interval is commonly seen in patients with myocardial ischemia and MI, indicating the need for urgent revascularization procedures. D. A shortened QT interval is mainly attributed to antiarrhythmic therapy and the presence of ventricular arrhythmias, warranting immediate discontinuation of medication and consideration of alternative therapies. E. Both a prolonged and shortened QT interval are typically benign findings and do not necessitate further investigation or intervention in clinical practice. All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B. A shortened QT interval is associated with the use of antiarrhythmics, myocardial ischemia, myocardial infarction, MI, and potentially life-threatening ventricular arrhythmias, requiring careful monitoring and potential adjustment of medication regimens. This option accurately identifies the conditions associated with a shortened QT interval, emphasizing the importance of recognizing this abnormality in clinical settings to prevent adverse cardiac events and guide appropriate management strategies. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Incorrect because a prolonged QT interval is not primarily linked to hypercalcemia and digoxin toxicity, but rather to conditions such as electrolyte imbalances and certain medications. C. Incorrect as a prolonged QT interval does not commonly indicate the need for urgent revascularization procedures, but rather suggests potential cardiac arrhythmias requiring monitoring and intervention. D. Incorrect because a shortened QT interval is not solely attributed to antiarrhythmic therapy, and discontinuation of medication may not always be necessary, depending on the clinical context. E. Incorrect because both a prolonged and shortened QT interval can have significant clinical implications and require further investigation and management to prevent adverse cardiac events. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.